Epicatechin's a small molecule drug. Yeah,
Epicatechin?
it's epicatechin. It's a people might recognize it because it's a product which is found in green tea and chocolate, actually. But given at relatively high doses,
Oh, yeah.
500 milligrams orally daily, can actually change the ratios of what we call follistatin and myostatin. And these are components of muscle which regulate sort of how much muscle you have. The more follistatin you have, the more you prevent the breakdown of muscle. And so, particularly as you get older, that can be effective in patients as well.
Hi, I'm Dr. Ross Carter, and today we're going to be talking about how peptides help with sarcopenia.
Absolutely. So my name is Ryan Smith. I helped found a compounding pharmacy called Tailor-Made Compounding, which specializes in peptide pharmaceuticals in the integrative space. And so here at Tailor-Made, we've done a lot of different things, but we've really tried to pioneer and educate physicians on these newer treatment strategies so they're able to help their patients with a variety of conditions and diseases. And so we've been relatively successful here at TaylorMade. We've been the fourth fastest growing company in healthcare, the 21st fastest growing business in the United States. And it's all because we're blessed with proximity to great physicians and prescribers. And we're specifically focusing on these innovative compounds, which can really, really help people.
Are there peptides really good for helping with losing weight? I guess you would have to accelerate your metabolism possibly, or other things that mobilize fat. I don't know what peptides are best for weight loss. What are there any?
Yeah, unfortunately, weight loss and muscle building are one of the areas where the peptides have a little bit of trouble. Probably the most frequently prescribed peptides for weight loss are actually really common ones that most people use in diabetic treatment. I think it's like the liraglutide or the semaglutide, those GLP-1s, which basically help sensitize your body to insulin. And so those are very, very common prescribed products, which do have a weight loss benefit. You might recognize some of the commercials where they said, hey, this product may cause weight loss, but it should not be prescribed for weight loss, right? So those are frequent. A lot of the ones that we do as well are the growth hormone secretagogues. Obviously, growth hormone has an effect on body composition, increasing lean muscle mass while decreasing adipose tissue, particularly visceral adipose. So there are the growth hormone secretagogues. There's a lot of those which are available. Things like the tesamorelin, the CJC 1295, the ipamorelin. Those are probably the most common, and those work on increased.
Let me write those down because everybody's going, wait, what did you say? You said tesamorelin, right?
Yeah, tesamorelin, the CJC 1295. Usually that's, CJC 1295, usually used in combination with another peptide called ipamorelin. And then, really, I would say that those are probably the two most frequent peptides which are used for growth hormone therapy. Some of the more classic ones, which are now, I would say, going out of clinical use, are things like Sermorelin, or the GHRP2 or the GHRP6. And so that's another way, because obviously increasing growth hormone can have a body composition effect. And so that's another way to affect change. But, it's very reliant on all the lifestyle things, how much you exercise, your diet, and so beyond that, there's a variety of other products, which, can be used in combination to help with weight loss. But I would say it's one of the areas where, nothing is absolutely phenomenal. One of the things I do like to talk about is a product which is frequently discussed for weight loss called AOD 9604. The AOD 9604 stands for anti-obesity drug. But unfortunately, while it also goes by the name HGH fragment 176 to 192. So it's one of those products which is a fragment of growth hormone and had tremendous results in animal studies. But this is actually one we own the patent to. We took it to phase 3 clinical trials in humans and did not get, I would say, good results. And so although you see it online, I would almost never recommend anyone try it for weight loss.
Gotcha. Well, what about people as they get older and they have problems with muscle wasting? Like now I'm
Sure.
50 and I don't want to lose my muscle that I've had my life.
Sure.
Are there some really what recommended peptides are there to enhance muscular development?
Sure. So usually, again, peptides are a little bit lacking. Most of the time, small molecule drugs are going to be a little bit better on this. So things like, yeah. So things like your replacements in testosterone. One of the ones that we always, have a good results with are things like the IGF-1 increasing products, like the growth hormone secretagogues. So the things like the same products we just talked about for weight loss, the tesamorelin, TJC, and ipamorelin can also have an effect in increasing lean muscle mass. And so that one those are another common pathway. One of the ones we like as well is actually a product called epicatechin.
Sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. On with the show.
Epicatechin is a small molecule drug. It's epicatechin. It's people might recognize it because it's a product which is found in green tea and chocolate, actually. But given at relatively high doses, 500 milligrams orally daily, can actually change the ratios of what we call follistatin and myostatin. And these are components of muscle which regulate sort of how much muscle you have. The more follistatin you have, the more you prevent the breakdown of muscle. And so particularly as you get older, that can be effective in patients as well. And then lastly, going back to what we started the conversation with, the SS31 has an effect on preventing muscle wasting or sarcopenia as a mitochondrial product, which is one we recommend as well.
So you've listed like 4 or 5 different ones that'll help with sarcopenia, basically, and those would be great. So can you run down the names of the 4 that you listed again, just quickly?
Yeah, absolutely. The ones I'm referencing are going to be natural products or peptides. I don't think that these are nearly as efficacious as what testosterone or hormone replacement therapy might be. But those products are going to be the growth hormone secretagogues. So that includes things like the tesamorelin and the TJC. The second one would be the epicatechin, which is that natural derivative of tea and chocolate. And then lastly, the SS31, which is that mitochondrial peptide, which can help muscle cells function optimally and therefore not waste away.
Oh, beautiful. Well, thank you for that. All right. So is there an area of category of peptides that is a big category I'm missing? Or what about pain management? Is there anything on pain?
Yeah. There's a lot on pain. There's a lot on nootropic. One of the biggest things that I would say, and unfortunately, I might have to hop off here just in a little bit. But one of the biggest things I want to say about the peptides generally is that they are affecting every area of medicine. There's not a single area of medicine where these drugs are not being developed. And so if you can think about any particular area, you can definitely find a peptide which is applicable. So this includes things like oncology, cardiovascular disease, metabolic disease, even, infection management or pain or neurological function. And so all of these peptides are becoming more and more popular in all of these areas, and we could spend all day talking about all the different categories. So, just to sort of wrap up as you relate to pain, I want to go back to the first one we talked about, the ARA 290, which is able to reduce inflammation and help with neuropathic pain. It looks to be like a breakthrough medication, which we're really, really excited about.